Good afternoon. This is Dr. Ara Deukmedjian, CEO and founder of Deuk Spine Institute, and we are broadcasting our spine surgery live today. This is our third surgery and last. Our patient has a herniated disc at L4-5 off to the left side, and he's having pain in his back and leg. So he has a choice, like everyone: live with the pain or get it fixed. And to get it fixed, there's a choice. You know, a good fusion, a cacophony of sound. A good fusion would do it. But you don't want a fusion, do you? I don't blame you. You don't want screws and rods. So he wanted the Deuk laser disc repair. All right, we're going to get started. That's my hand touching you, okay? Are you comfortable? All right. We're going to keep you awake for a few minutes, and then we're going to put you to sleep. I need you awake for 10 minutes. All right. Now, if you feel pain, just say, ouch. That tells me you're having some pain, and then I'll give you some more numbing medicine, okay? All right. But you're comfortable otherwise? All right. I'm going to do a little stick and burn. That's the numbing medicine going in. Do we try some bicarb?
We didn't have any.
No.
Only the cracker.
It's not the one that we have is
Luis.
yeah, we have, but it's not for
Understood. Yeah, that's just the numbing medicine. I apologize. So are we going to be
Disc
ordering it?
herniations are a common cause of chronic neck pain.
Because we talked about it like last week, right?
Yes, sir. Yes, sir.
I hate having to tell people to do things twice. All right, needle is here. Watch it. We put in 4 cc's. Okay? He's like, okay. He's like, all right. All right, blood pressure looks beautiful. Remember, don't move around. If you feel anything, just say ouch, and I'll stop and give you more numbing medicine, okay? All right. You remember, you have to be awake for the beginning. I know, I'm sorry. All right, I'm going to be talking to my team, okay? Let's go lateral. So we can see on the MRI the L4-5 disc is dark and abnormal in structure and color and shape. Okay, so we know there's an injury, but otherwise he has a beautiful spine, perfect, and we want to keep it that way. Okay, he has a nice curve. Everything else looks good. He just has an injury to that disc, and we're going to go fix that disc so that will take his pain away. Let me know if it's hurting you. A little bit? All right, let me give you some more numbing medicine. Now, fusion surgeries are very invasive and bloody. They cause a lot of scar tissue and a lot of pain. And the patients that have fusions have to be on painkillers for months. Some of them never come off the painkillers. We don't want that for our patients. That's why we do minimally invasive surgery like the Deuk laser disc repair. Okay, shot. And patients have a choice. They don't have to have a fusion if they don't want to. It's their choice. I know for me, I would never want to do a fusion if I had this problem. I would have another doctor help me and do this procedure. Shot. Is your dad is here today, or your wife?
My mom and my wife.
Oh, your mom and your wife. Okay. All right. So we are aiming for L4-5. Yes, I know it's a little bit uncomfortable. Shot. But you're doing fantastic. Just bear with me, okay? We're almost done. Where do you feel that? In your back? All right. Just relax a little bit. So we're near the facet joint. That's what's making you unhappy. Okay? Just relax. We're almost done. I can't give you any numbing medicine down here because that would numb your nerve. And then you wouldn't be able to walk afterwards until it wore off. So I don't want to do that to you. You'll be not happy with me. All right, AP. I can actually feel the herniation right now with the tip of the needle. You're doing fantastic. We're almost done. And we're going to put you to sleep, okay? I just need you awake for like 2 more minutes. Perfect. All right. So perfect positioning. We're in the foramen. We're right at the lateral part of the disc. I have to move forward a little bit more, but you can actually feel the herniation. And you can see on the AP view, it's perfect. Everything's going perfect for you, okay? I just need you to be patient with me and bear with me. Shot. I know. I know. You did great, okay? Okay, everybody agree that's L4-5?
Yes, sir.
And that's the level we're doing?
Yes, sir.
Are you comfy? Have you watched any of my surgeries? Any surgeries recently in the last year? Interesting. I thought for sure you'd watch. You don't like to watch, do you? Well, you did great. We're actually where we need to be. I just need to check one thing. Now, you're having back pain, right? And are you having leg pain? So whenever you lift something heavy, it goes from your back down your leg. But the back pain's always there. The leg pain just comes and goes. All right. So there you have it. Everybody's story is a little bit different, okay? And in his case, he has constant back pain right here. Your back pain's in here, right? And what?
More towards the left.
Yeah, more towards the left, like right in there. So whenever we fix somebody's disc with the Deuk laser disc repair like we're doing, we always want to know for sure if that's the cause of the pain. How bad is that? How bad on a scale of 1 to 10? So he had a 10 out of 10. Just relax. We're done. I'm not going to torture you anymore. Guess what? We found the problem. Huge tear in the disc. And you can see the dye leaking out around the nerve root. All right. You relax. Was that where you typically get back pain? All right. I want you to count from 1 to 100 for me out loud. You can count in Spanish if you want. I'm a sensitive guy. All right, you're going to feel a little stinging in your arm. That's the propofol. So we're going to put him to sleep now so we can do the surgery. But basically, we just confirmed that his pain is indeed coming from the disc at L4-5. I knew it based on the MRI and where his pain was, but it's always good to make 100% sure by doing a test. And that's what we just did. But you don't want to do this test and then have him come back and then do a surgery. You want to do it all at one time because it's painful and uncomfortable. So we just confirmed during surgery. It also gives me the ability to see the tear, which I can see, and it gives me the ability to stain the nucleus blue so I can get it out easily. Lay still. Lay still. You're doing good. Keep counting out loud. All right, take another. Lay still. Take another shot. You can't skip ahead to 900 or 99. You got to go by ones. He's trying to get there quick. He's like 1, 2. Oh my God, 99, 100. All right, you're doing good. Lay still. All right, show them where the tear is. We're going to put an arrow on the fluoro. So go back to the fluoro, Diego. And yeah, that's a little bit outside the tear. Go to the right. There it is. So show them the tear there. Yep, right through there. That's the black stuff coming out. And then show them the nerve root getting where the dye's kind of wrapping around the nerve root. Yep, going up the foramen. Take them up. That's the nerve root right there, okay? So you can see how it goes right behind the herniation. Very good. Thank you. So now that he's asleep, we've got the guide wire in. We're going to take the needle out. And by the way, the needle went in easy because there's a giant tear. It's huge. Okay, we're going to make an incision. So the whole surgery, watch this incision. The entire surgery is going to be done with a small incision. I'm going to show you for just a second here. Okay? If we were doing a fusion, can you see this, Diego?
Yes, we can.
If we were doing a fusion, no. Is that better? What's better, this now or before?
This is better, yes.
All right. Okay, so take a look. If we were doing a fusion, this would be the incision we have to do. Okay? There to there. If we were doing a minimally invasive fusion, we would do one incision and another one and another one. And by the time you add them all up, you know, they're pretty close to the open. If we were just going to do a microdiscectomy, which won't fix his back pain, only help with the leg pain. And remember, he always has back pain. That's what he wants getting rid of. He occasionally has leg pain when he lifts something heavy. So if we were doing a microdiscectomy, the incision would be about that big. But that would only help the leg pain, not the back pain. So that surgery wouldn't even work. Microdiscectomies don't fix back pain. Laminectomies don't fix back pain, ever, because you're not fixing the disc. The disc is the source of the pain. The only thing that stands a chance of getting rid of back pain is a fusion or an artificial disc. And an artificial disc is put in through the belly. Now, the laser surgery, which is what he's having, the incision is this big, okay? So why does it matter how big your incision is? Because incisions equal trauma. The bigger the incision, the more trauma that's done to your body under the skin. You understand what I'm saying? Like, people need to understand that what happens on the surface is not representative of what happens inside. There could be major trauma happening inside the body, but all you see is a little incision. But I can tell you right now, little incisions like this create far less trauma than the bigger incisions for open surgery. And the trauma I'm talking about is trauma to your soft tissues, your muscles, your fascia, your bones and ligaments of the spine. The Deuk laser disc repair, that's good, doesn't create any trauma. It's very minimal. All right, you see we're almost to the disc already. We're going through the foramen, the natural hole in the disc. We're past the facet joint, and we're going to enter the tear right now. I can feel the herniation. I'm pushing against it. And now we're going to enter the tear in the disc, which is the same place the herniation is. When I say tear, I mean herniation, tear. They're both related to each other. They're in the same place. Okay? Yeah, it just went in so easy. I mean, it really didn't take much effort at all. That's because this tear is so big. He has a giant tear in the back of his disc. And that's where all of his pain has been coming from. And it's coming from inflammation in the tear, in the back of the disc. That's what we discovered here at Deuk Spine. Why do we say that? Because, yes, we're the first people to discover it, but also understand that the doctor where you live is not going to know about it. They're not going to be able to tell you what's happening in your body because they don't understand it. You know, that information hasn't gotten out there yet. It hasn't disseminated. We call it dissemination, when things spread. Lay still. So he's not really awake, but he is moving a little bit. And he's just, it's kind of reflex. His body just reflexively moving. So there it is, 7mm incision. All the surgery is done with a tube. It's going to take us 15 minutes, and guess what? He's going home about 30 minutes after his surgery. And by tomorrow, he'll be wide awake and back to normal. He can go do everything, watch a movie, go out to dinner, go get his nails done. What? You guys don't think men get their nails done?
Of course.
Okay. All right. I get my nails done. I can't reach them myself anymore.
Yes, sir. Can you check the towel?
Is it on? Don't touch the camera. Is it plugged in? Put it down. Yeah. But it may not, there's a switch in the back of that unit that may be down. That may be off. Is this the one that went out?
No, this is the one that we, it was on just right now.
You just turned off the copier or whatever that is, the recorder. All right. So we're having a problem with our light. Hey, we need Sunny Diego.
Okay, I'll go get him.
Go ahead and break scrub, Luis.
The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com. Traumatic injury to the disc can cause annular tears to form. Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com. Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com. Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear.
Again,
The
thank you,
annular
guys.
tear heals on its
Sonny,
own.
We need this resolved immediately. You know what I mean? You ordered the other one? Yeah, it's on its way. Good. All right, are we back?
Yep, 3, 2, 1, you are back.
Dr. Deukmedjian, I'm back. Obviously, our light box went out, which happened in the last case. We lost power to the light box, which produces the light. And it was a blown fuse. So this is the herniation, by the way. Look at that. Turn on the light. Let's show them the herniation. Can you all see that? It looks like a little ghost. You all see it? You see it, Diego?
Yeah, good shot.
He's a little bit too light. Moving around a little bit. So the herniation rarely comes out as just one piece. You can see there's other pieces here, but that was a big one. And we're going to get the laser in here in just a minute. But I like to take as much of the loose herniation out as I can with the grabbers, because the laser doesn't work great to get big volume. You want to use the laser for smaller volume tissue removal, and use steel instruments for larger volume tissue removal. All right, let's put the laser on. Okay, so this patient has a herniated disc at L4-5, and we had to pause for a moment because we lost our light source. The light source basically feeds powerful light down to the tip of the scope inside the disc, and our light source went bad. Why is this fiber jumping so much? Look at that. There's another piece of herniation. Yeah, this disc is pretty badly damaged. That said, he'll do fine once we repair it with the Deuk laser disc repair, but I'm amazed at how much damage there is. It was really damaged pretty badly, severely traumatized. There's a lot of fragments. You can never really tell on the MRI. You can never tell just how badly damaged the disc is. The MRI doesn't show the details that well. But when you get inside the disc with the scope, boy, you can see a lot. You can see everything. This is a view surgeons don't normally have, folks. I never got this view ever until I started doing endoscopic spine surgery. This is not something that's taught in neurosurgery or orthopedic surgery residencies. There's only a small number of us around the world that know how to do this kind of surgery, and there's only a small number of us around the world that have looked inside of a disc and know what normal looks like and what abnormal looks like, and this is just really shattered. But that said, I think he'll be fine. I think that there's enough of the disc left that he'll be fine. So we're just fixing one disc with this patient, and then we're going to go check on our last patient and send him off. He's ready to go home. He's recovering in the recovery room and he's ready to get out of here. So he's just waiting for me to go by and see him. Which we'll do as soon as I'm done here. So we're not going to take any questions on this one at the end. So if you have questions, this is the time to ask them.
Okay.
We're going to go from here to the recovery room, and I'm going to check on my patient. And if we can do a broadcast, we will. He may not want to, and that's fine. We respect people's privacy.
We have a question from Facebook.
Sure.
Does this procedure help permanently? And what
So
percentage?
again, I can't hear you. Your volume's a little low, and your words are mixing together.
How about this? Is this better?
Yeah, but enunciate clearly.
Does this procedure help permanently? And what percentage of people are coming back for a second surgery?
Yeah, good question. So the first question is, does this procedure, is it permanent? The answer is yes. The effects of the surgery is permanent. We studied patients that had this done 6 years after their surgery, on average, 6 years. And 95% of the back pain was still gone, and 95% of the leg symptoms were still gone. That's better than any surgery I know in spine. There is no other surgery that works that well. 95% elimination of back and leg symptoms 6 years after surgery. Not even fusions or artificial discs have that good of results. And remember, that's for all comers. We didn't select certain groups of patients. That was everybody that had lumbar, lower back. The next question was, what percentage of patients have to come back and have the surgery redone? The answer is 1%. 1 in 100 patients will end up reherniating their disc and having to come back. So the reoperation rate for this surgery is 1%. It's much lower than other types of surgery. The reoperation rate for fusions is somewhere around 10% to 20%, depends on which article you read and the type of fusion and the surgeon and the hospital and the selection criteria or inclusion criteria. But in general, reoperation rate for spinal fusion is around 10 to 20%, probably averages 15 across multiple studies and physicians and techniques. My reoperation rate for fusion was 1%. My adjacent level operation rate for fusion is around 2%. So 1% of my patients come back for fusion because they have a problem where I did the surgery with the cage maybe moving. And 2%, this is published data, pretty sure it's published in one of my papers. We had to do another surgery for adjacent segment disease. So a disc above or below the fusion. So. All right, just about done. We need 5 minutes maximum. We'll be done. You can see the end plate of L4 on the left, the gray, the beigeish color, and the end plate of L5 on the right, just past the blue, right there. Any other questions?
No.
I'm sorry? Yeah, I'll try to show you the nerve. Sometimes we can see it, sometimes we cannot. The nerve actually lives in the foramen where there's fat, and the fat covers the nerve, and it makes it really hard to see. What we see is fat, basically, around the nerve. The nerve has a lot of fat because the nerve is very metabolically active. It uses a lot of energy to transmit nerve signals. Nervous tissue uses more energy per gram of tissue than anything else. So there's a dramatic need for energy, and the brain itself will not use fat. It only uses sugar, glucose. However, the nerves, peripheral nerves, can use fat in the form of ketone bodies, and that's why they have fat around the nerves to pad them in the foramen, but also to provide energy. Pretty cool stuff. Just about done. This is all scar tissue. Oh, the light intensity just went up for some reason. Just a little bit, just like a little, there it goes, it went down again. It's weird. You see that? I'm not imagining it, am I? Huh? Wonder why. You know, Luis, maybe we buy 2 more light boxes,
I was thinking about that.
right?
Yeah.
Just because one of them is going to have to be
Can you tell Sony, please?
repaired. Yeah, Sonny already bought one.
Yeah, so maybe they have 2. I don't know.
Yeah, I think we should buy another one. Just to have another backup as we're getting busier. And I want them all working. Okay? So we should have 4 all operational, ready to go,
Yes, sir.
with bulbs. You know what I mean? With the light bulbs.
Yeah, I'm gonna order, more light bulbs. We have one more, so.
Sonny usually finds them, they're pretty good price, right?
Yeah.
Yeah, Sonny is very good at finding things. If you ever need anything online,
Well, I need a cardiac monitor too. Cardiac monitor.
we do need another cardiac monitor. A pump? For the what?
For nitroglycerin, so you need- for nitroglycerin. You need it.
Remember what that's for. Remind me what the... Huh? Oh, okay. Yeah, let's get it. Just tell Sonny what you need. Can you find it? You know, I want to make sure we get the right brand, the right manufacturer. We need to get the right, I want you to get the right model. Right? All right, we're just about done. 30 seconds. This is the last chance to ask your questions if you have questions, folks. We've had one request to see the nerve root, which I'll do my best to honor it. This is lateral. And what can I say? One more person saved from a fusion surgery. It's always a good day when you avoid a fusion. Right, Luis?
Oh, yeah.
Okay. All right, so the nerve should be right up here. There it is. You can actually see it right there. Pretty cool, huh? So a few strands of tissue and fat around it, but that's the nerve. All right. So it's going to take a while for this disc to heal completely. And he's going to have to really behave not to be lifting anything heavy. We need at least 2 working light boxes next week.
Nice one, please.
You know what I mean? Joe Green. All right, any questions?
No
I
questions.
got it.
You have a specimen?
Look at that, Luis. You know, it cleans it out so nicely when you, I don't think we need the big one. I'd say we could probably use the normal one and just squirt down that thing. Dr. Rafferty, you did good today. Oh, so let's show everybody. The whole surgery was done with this little tube. We'll put some pressure. And Diego, yeah, you can break that down. I think you should look for more scopes too. Scopes,
Yeah, that, I mean, I'm
cameras, but also the camera.
Lumbar for 4,000.
You know what I'm saying?
Yeah,
How much?
4,000.
It's good, but it's the right one.
Is that right?
Used.
Yeah.
I'm okay with that.
Yeah, okay.
We're not going to find it much cheaper than that.
How about cardiac monitor for 3,000? That's okay?
As long as it's the one they want.
Same guy from the anesthesia.
But it's the
1
good.
year warranty.
But I want to use the same monitor.
You want this one?
Mindray, right?
Yes.
Because you don't. What we don't want to have is a bunch of different monitors that the nurses have to learn how to use each one.
Yeah, no, but that one is not.
Huh? You want like the standard, want to standardize it so it's the same manufacturer, same unit, so it's easy to use. Yeah,
It's okay with you?
of course. All right, take a look. We have an incision, 7 millimeters. The whole surgery was done through there. Thank you, Luis. Great job today. Great job, everybody. Jordan, awesome job. And any more questions before I get out of here?
No questions.
Thanks for watching.